When it comes to the accuracy of diagnostic tests, diagnostic sensitivity and diagnostic specificity are crucial metrics when choosing the right test. However, these two metrics are directly influenced by the prevalence of the disease being tested. In the case of influenza, there is typically a seasonal pattern, with low prevalence in warmer months and high prevalence during colder winter months, during which there is a higher probability of outbreaks. The diagnostic sensitivity tells us how good a test is at confirming people who have the disease, known as true positives. However, false negatives can occur when a person who in reality has the disease produces a negative result. These false negatives will be indistinguishable from the true negatives unless additional or different test methods are used. Tests with higher diagnostic sensitivity result in fewer false negatives. False negatives are more common when prevalence is high, so flu rapid tests with higher diagnostic sensitivity should be used in periods of high prevalence to reduce the number of false negative results. The diagnostic specificity tells us how good a test is at confirming people who don't have the disease, known as the true negatives. However, false positives can also occur when a person who in reality does not have the disease produces a positive result. Tests with higher diagnostic specificity result in fewer false positives. False positives are much more common when prevalence is low, so highly specific tests should be used in periods of low prevalence to reduce the number of false positive results. From a population of 1,000 people, let's assume that 100 of them carry the disease. If your test is 95% sensitive, and you perform this test with 100 diseased people, you can expect to get 95 true positive test results and 5 false negative test results. From that same population of 1,000 people, let's select 100 people which don't have the disease. If your test is 95% specific and you perform this test with 100 non-diseased people, you can expect to get 95 true negative test results and 5 false positive test results. No test is 100% accurate. False positives and false negatives result in misdiagnosis of the patient. A false negative can result in delayed treatment or the patient unknowingly spreading the disease. A false positive result may result in the unnecessary prescription of antivirals or missing out on the necessary treatment for their actual disease. Choosing a high-performing diagnostic test means finding the sweet spot which best balances false negatives and false positives. Having a test with high sensitivity and high specificity allows for confidence in the results, whether the disease is in high or in low prevalence in the community. When choosing an influenza rapid test, choose one which hits the sweet spot between sensitivity and specificity. Visit awesometests.com for more information on the Awesome Ultra Plus Flu Test.